Hey everybody, I just wanted to start this week's episode first by giving a big thanks out to Dan John, who just went through an interview. If you haven't listened to that interview, please go back to last episode 29, and take a listen. There's a lot of good information there. Now, the one thing I wanted to do before we started this episode is to thank Dan for coming on, but also to make sure everybody knows where you can get his material. He has written several really good books in regards to training and athletic development, and I highly suggest you can check them out. My favorites are all of them. I know I say that, but at the same time, Never Let Go is a great book. Can You Go is how he evaluates. Intervention is how he trains. Now What is how he performs, and a bunch of other stuff. And then, to be honest, one of the main books I feel like I got a lot out of is 40 Years with a Whistle, and that's kind of his story and how he went through different phases of his athletic career, as well as his coaching style and those that had influences on him. So highly suggest you guys go check that out. Also, he has a website that has a ton of great information on it. It's danjohnuniversity.com. If you go there, there's a lot of cool resources, one of which is the workout generator. Basically, you can put in any type of equipment that you have, and it'll spit out a program for you that is top notch. And it's something that I've used in the past, and I highly recommend. To be honest, I still use it now. It's written my programs. It's nice because Dan basically writes my programs using that workout generator, and I can't recommend it enough to everybody. So please go check it out, danjohnuniversity.com. All of his books are there. Please go look for those and support Dan. And again, we thank Dan for taking the time to come out and podcast. On this episode of the Athletic Potential Podcast, we'll be discussing shoulder impingement. We'll be discussing whether gaining strength is more important than gaining mass, or vice versa, in our throwing athletes, and our best and ideal off-season throwing programs, or even year-round throwing programs for our athletes here at Athletic Potential. Hey everybody, welcome to the Athletic Potential Podcast, episode 30. And today we're going to go back to the traditional format. After having our guest episode last week, we're going to go back to our traditional format of talking about a case, typically the last case I treated before the recording of this podcast, and then we'll go over some question and answers or questions from our audience. So this week's case is a case of shoulder impingement. Shoulder impingement is kind of an interesting term nowadays. It's seen some controversy lately, whether it actually happens or not. And it's all about how you define it. But basically, when we talk about shoulder impingement, we are going to be talking about pain that has shown up in the shoulder and is limiting the ability for this patient to move. It's a 40-year-old recreational athlete, someone who likes to lift and work out a lot, has kids, and tries to keep up with his kids in all their athletic endeavors. And he recently started having more pain in his shoulder. He noticed he wasn't able to do bench pressing in his workouts. Any pressing overhead was also problematic. And then he started noticing that he was having pain with overhead pulling activities, such as pull-ups, lat pull-downs, those type of things. And then anytime he would try to reach to even like put on a shirt, sometimes he started having pain. Most of his pain was located in the front side of his shoulder, and it would radiate down into the arm a little bit. And he came and saw us. And so when we did the evaluation, what we found was that he had full range of motion in his shoulder, but it definitely had a painful arc, is what it's called, is when you raise your arm up. If you have pain, essentially from a certain degree of motion, those that are watching, you can see that anywhere from here, which is around 135 degrees or 120 degrees, just to about 155 degrees, you have this painful motion or painful sensation and symptom, and then the pain goes away as you go up overhead more. And our client definitely had this issue, and when we went to correct for it, which is we basically helped the shoulder blade stay in a better position, his pain levels dropped a little bit, which is more of a traditional sign of an impingement syndrome. There's specific testing and those type of things that also indicate impingement syndrome, but basically those tests they're good, but they're not great. But he tested positive for that as well. Now, nothing really brought this on. That was the one thing I was a little concerned, is that when we talked to him, he basically was like, yeah, I don't really know what brought this on. I just noticed I was unable to do pressing activities during my normal daily workouts. And it started to increase to the point where he wasn't able to do more and more of these activities. And just to give you a timeline, it'd been around 3 or 4 months, and had progressed to the point where he felt like he needed to be seen. And so he came in, we saw him, we evaluated him. We definitely identified that it was more of this what was happening was as he raised his arm up over his head, the two bones, the bone on the top, which is called the acromion, so the ceiling to the shoulder, the ball, which lives underneath that, was they were running into each other and creating an impingement or pinching of those two bones together. Now, something that I want everybody to take away, and this is one of the reasons I was happy to discuss this case today, is a lot of people say, well, oh, it's just impingements, those two bones that are impacting together. Then why does it continue to hurt after it's gone? Because this is what he had before. And it's just kind of this achy pain that stayed in the front side of his shoulder and went down his arm. And what happens is, as you raise your arm up and you create that impingement, what happens is there's a tissue, there's multiple types of tissues there, but basically a rotator cuff tendon and what's called a bursa sac that both live between those two bones, and they get pinched and they get hammered and they get angry and mad, and then they create this pain that aches over time. And so you've got to get those tissues also to be calmed down. So the way the treatment works is we want to decrease the amount of impingement that's going on, which is all about making sure the shoulder blade and the shoulder and everything works correctly together. But then also we got to take care of those tissues. And so in this case, what we've done is we did a lot of shoulder mobilization, which seemed to help him, basically stretching his shoulder out in the right ways. And there's a very specific way that needs to be done. You can easily make this thing worse if you do the incorrect type of stretching. So not all stretching is created equal. And so we did some mobilizations in his shoulder. That automatically took that painful arc almost completely away in one visit, which is fantastic. However, he still kind of had that achy pain there. And so we used two different types of modalities. Essentially used dry needling to the area. We didn't go inside the joint. We just kind of stay around the joint, but it helps us run electrical current through electrical stimulation, which is the second modality, through the area, and that desensitizes it. So we, after the mobilizations, we did the dry needling with electrical stim, and that seemed to help quite a bit. He said he had less pain. He could move around a lot better. And that was it for first visit. And then the second visit, he came in, he reported he had a significant reduction in his pain. However, his painful arc had come back. It was still there. But he had less achy pain. And so what we did on the second visit is what you have to do in order to get this thing to go completely away. So for those that are listening, if you have continual shoulder pain, the typical issue is that people lay off of the movements that hurt. And then all those tissues that are kind of aggravated because they've been getting hammered in there, they all get better. And, because you've stopped doing the activity that irritated it. But the problem is the minute you go back to those activities, what happens is the tissue gets beat up again, and then it starts hurting again. So if you really want this thing to go away, you've got to take care of the original cause of the problem, and that is typically a movement problem. And in this guy's case, in our patient's case, it's the fact that his shoulder blade just didn't move very well, and to be honest, his posture is not very good. And he kind of stood in a posture that allowed for his shoulder blade to be in a bad position. So anytime he'd go to raise his arm overhead, that impingement would happen. No joke, we fixed this in one visit. Not trying to boast or anything, but this is how simple it can be. We taught him a posture drill where he stood up against the wall, and we fixed his pelvic position and lumbar spine posturing. That's your lower back. All we did was put it in the better position. We had him activate his abs, kind of get in this nice tall posture, and he was able to raise his arm completely overhead in the clinic, no pain at all. We dry needled again to knock down the irritability to the tissue in the shoulder. And he had a third visit scheduled for a week out. We talked on the phone. He didn't need it. He was feeling fantastic. I suggested that he continue doing his exercises and then come back to us in the week following. And he did, because basically at that point, I was going to go teach him how to do pressing activities with proper posturing and shoulder blade positioning so that he could get back to working out. It wasn't about just getting rid of his pain, even though he got rid of his pain within 2 visits. We spent the next 3 to 4 visits, about 5 or 6, I think it was 5 visits total, teaching him how to do the lifts again. And he's completely back to doing everything he wants to be able to do. Including throwing, which also hurt. Now, he is not a thrower. He's just a recreational athlete, but he has kids that like to throw football. And so he was able to throw football without any pain, which is fantastic. So for those that have been dealing with any type of shoulder pain like this, just know that there's usually 2 things you have to do. One, you have to decrease the irritability of the tissues that are getting beat up. That's, rest will help. But in our case, we use a lot of different things outside of dry needling. I know I mentioned that quite a bit, but that's because dry needling is highly effective. So we use dry needling quite a bit. So if you have an option to find somewhere to go do that, I would do that. And then we have to teach the shoulder blade and everything how to move correctly, which in all honesty, if you don't know what that looks like and what that means, you can throw a whole bunch of exercises at your shoulder and shoulder blade and hope one of them sticks. But I would highly suggest finding somebody that can teach you the proper mechanics of a shoulder blade and maintaining good, correct posturing. And if you do that, I think you're going to be out of pain a lot faster than you ever thought possible. This is a question that he asked me almost directly after the last visit of him training through it. And he goes, hey, I think I know the answer, but what if I had shown up 2-3 weeks after this had happened? Do you think we could have avoided some things, or what do you think the outcome would be? And I said, well, how bad was the pain like 2 to 3 weeks into this? And he says, well, it really wasn't bad. I said, to be honest, it would probably have been 1 treatment and 2 treatments just to make sure you're moving correctly, and it would have been totally fine. And it would have been, we'd have avoided it. And I actually venture to even say, if I had seen him sooner than that, within a couple of days of it, we could probably just addressed his posture and not had to do anything to the tissues, because I think they would have been okay. They'd been maybe, a little irritable, but a little bit of rest followed by good posture training, and I'm willing to bet the pain was gone. So the point I'm trying to make here is I see a lot of patients that come in 3, 4, 5, even 6 months, even longer, having these issues and just trying to let things heal on their own. I'm a little bit aggressive in nature. Just I like to be aggressive with things. I like to take action on things more often than not. Especially in regards to treatment. And I highly encourage anyone that's having any type of pain anywhere, really, but if we're talking specifically about shoulders right now, if you have shoulder pain, it's not something you're going to want to just let go away, because typically the shoulder is telling you something that's you're moving incorrectly somehow, and structures are getting irritable and frustrated, and then eventually they start getting damaged. And you really want to maintain shoulder health as long as you possibly can, with as much use of your hands and as our arms as we do on a daily basis. You really need to make sure those shoulders stay healthy, and it definitely pays dividends down the road to get in and address these issues quickly with someone who can help you. So plug for physical therapy or any type of rehabilitation specialist to try and help you with that. Just make sure you find somebody who knows a good mechanics of the shoulder and the shoulder blade, and I think you're going to be really happy with the results, and you're really not going to miss out on training time. The other thing to think about is, and I just thought of this, is this is a conversation I had with somebody yesterday, and I said, look, if you had addressed this 3 months ago, think all the training you could have done 3 months, rather than taking time off for 3 months and letting things atrophy, regress, and your strength levels drop, your power levels drop, all of these things that we now have to gain back. If you just address this quickly, you lose less, and you can actually then get back on track and start gaining strength and all those other physical and athletic attributes that you really want. And so, but anyways, yeah. So if you have issues, just go get them checked out quickly. You'll be happy you did. And it won't be, it'll be within a few weeks, so you'll be happy, but you'll look back and go, yeah, that was the right call, and not letting that stick around for as long as it could have been. So, all right. We appreciate it. Hang one second. Sorry, I had a little background noise going on, but yeah, so that's the case. So let's jump right into our question and answers, or questions from our audience here. So let's see, pull up the outline. So our first question comes from Jules, and Jules asks, what is your recommendation for a baseball or a softball pitcher who wants to be able to throw harder? Well, Jules, well, there's more to your question here. We'll get that here in a second. That is the question being asked in all of throwing sports right now. How do I throw a faster fastball, right? What's my velocities? Can I make them faster? Same thing in pitching and softball. Hey, what about, I want to throw the discus. I want to throw the javelin further. You name it. If you're throwing in your sport or athletic endeavor, you're either trying to make it go faster or you're trying to make it go farther, right? Maybe not curling, but you're trying to make all of these attributes go up. So, Jules, you asked the golden question, and if there was the singular way to do it, it would be already out there, and people would all be doing it. And actually, they are. We'll get into that. So, he continues his question and says, is gaining strength more important, or is gaining muscle size, atrophy, getting bigger, mass is gas is kind of what the phrase we've been hearing, right? Is that better? Jules, here's the deal. This really depends on the athlete we're talking about, age of the athlete, developmental timeline of the athlete, as well as experience, skill, and the ability for someone to have repeatable mechanics. And so let's do this, Jules. I don't have any of that information, so I can tell you this. Let me ask you a little bit more, or answer the question a little bit more directly in regards to, is muscle size or muscle strength more important? And I can tell you this. They come hand in hand in a lot of ways. If you're trying to gain strength, you're most likely going to gain some size along with it. But at some point, you may have to push, down the road to try and gain more size. But I can tell you right now, strength is paramount. First, it's your ability to produce force that's going to be able to help you be able to throw harder. And so, and we know this is true. We can see this throughout the baseball community. We've seen an increase of this in the softball community, especially as the softballers have started embracing weight training more and taking it more seriously over the past couple of decades. And we've definitely seen it. We've seen it in baseball. I hate to bring it up, a sore spot in baseball history, but the steroid era of baseball, look at what happened in regards to ball velocities and home runs and how hard balls were hit, and guys throwing how hard they were throwing, but not only how hard they were throwing, but just, how often they could throw and their ability to recover and maintain certain strength levels, which then allow them to throw harder for longer and those type of things. So we know what works. We know gaining strength is really pivotal. You have to have force. You have to produce force. And if the more force you can produce, typically the faster whatever it is you're going to be throwing is going to go. Now, there's kinetic chain linkage and your ability to be efficient in the way you do that, and putting force into the ground at the right timing. Those are biomechanics, right? So, if you don't have good mechanics, you can pack on a ton of strength, but if you don't know how to use it, it's probably not going to be as effective as it could be. So look at it this way. You look at some of these players in their careers. Just look at some of these guys. You go and you see their rookie. You see their rookie baseball card, and you look at them. And you're going, "Holy cow, they are tiny, right?" And they're thin. They're just not. They don't have a ton of size. And I know we're going to get into this here in a minute. And you look at them, and you're just like, "Oh my goodness!" And then you look at them 5-6 years later. They've had a great career, but they've gotten better and better, and they hit balls harder. They throw balls harder, and you're looking at them, and you're going, "Whoa!" These guys got big. And so size is the thing. Now, here's the thing I think is the most important for a lot of people to understand is I think gaining strength is extremely important. You need to have good prerequisite strength to be able to be successful. And I think size comes along with it, but size is appreciated over time, I think. Now, here's the thing. All those athletes that I just kind of mentioned, you look at the rookie card and you look at them now and you're just like, those guys are massive now. That's it. They got huge, and that's what's made them successful. I don't want anyone to overlook the simplicity of this. And that is this. Those guys had already almost mastered, or were continuing to master, the technique of hitting or throwing. Their biomechanics, their ability to move repeatedly in the same way, was there. And so what I want everyone to hear is, yes, is strength important? Yes, it's important. But if you cannot time up a swing correctly, or if you are unable to time up the throw correctly, you can pack on a ton of strength. And yeah, you'll probably throw a little harder, but I don't think you're going to see the results that you want to see. Get really good at the skill of throwing and the skill of hitting, and then continue to build strength in an appreciable size going forward after that, right? And now I say that and I go, that sounds like a youth athletic development model. Our kids are playing baseball at young ages, and that's okay. I don't think they should play only baseball. I think athletic improvement, a general athletic improvement is the key here. And the idea is learn to move well, then to learn the skills. So if in order, you got to swing, you got to throw, you got to do those type of things. And so I would definitely find ways to make sure that all the mechanical type things are as fine-tuned and as clean and as repeatable as possible. And then also at the same time, start increasing those strength attributes in regards to hitting the weight room and those type of things. Now, Jules, this is a very broad topic and very difficult to answer. And I feel like I probably bounced around with this. Let me tell you how we kind of manage a youth athlete coming up through starting young and then getting them all the way to the collegiate level or hopefully even the professional level. What that looks like is this: they're going to be playing. I can tell you right now. So 7-year-old comes in. I highly encourage them to play multiple sports that are seasonal. So we're going, okay, spring, you can play baseball, and even summer, you can play some baseball. Fall, you're going to play football. Or something along the fall sport line. And then in the winter, you're going to play some basketball or hockey. We live in a climate that allows for hockey. So basketball or hockey. And then spring's going to roll around again and you're going to start playing baseball again. And I think that's a great idea. And to play those multiple sports. Now, someone has asked me the other day, like, well, at what point should they stop? This is youth sports specialization. Just so you know, I tell them, look, I want you to play as many sports as possible at the highest levels as possible. So into high school, I want you playing multiple sports if you can. I understand that's not easy to do. I understand that can be very difficult to do, and there's a lot of factors there. But if you have the general principle and mindset of that, hey, look, I'm going to try and play, multiple sports throughout high school. I think you're going to develop a lot of good athleticism that's only going to help your baseball career, your football career, or anything like that, right? We've got a client right now, Athletic Potential here, that he's, 14 or 15 years old. He's playing basketball, he plays football, he plays baseball. And, football teaches him to be aggressive and to use his body and to take contact, but also how to move effectively left, right, forward, back, and also to kind of turn himself into a missile, and take somebody out if he has to, and work as a team in that way. He then plays basketball, which helps with his conditioning. He's a big kid, and helps with his conditioning and works on his speed a little bit more. And it also teaches him, I think, Dan mentioned it last podcast, it's called triangulation, right? Your ability to understand where everybody else is at on the court and how to try to maneuver in a way to best accomplish the goal. And then he plays baseball in the spring, and works on rotational power and his ability to throw and those skill-specific sports. And that teaches him to be a better football player, in the fall. And so play multiple sports through high school as long as possible, essentially up into high school. And just know that if we started you at 7, you can play all those sports as long as you can. Now, at the same time, I'm going to introduce that kid to a weight room in probably around 10 or 11. As soon as they seem interested in the weight room, I kind of want to introduce them to a weight room. What movements are important? Push, pull, squat, hinge, and some carrying. We're going to teach him those movements. We're going to make him very proficient in those movements with his body weight first. And then we're going to progress him to adding weights, typically in the form of free weights. And then from there, that's now strength building. So now we're working on strength and making sure to monitor that all the other physical attributes and performance metrics of his ability to run really fast and to jump high or jump hard or hit hard, or those type of things are not affected negatively by the strength training, but only should be positive. And we teach him more advanced moves as he continues to age and continues to go forward and into his teenage years, into his up into high school, and we're still building strength. We're seeing size come on now, just from the fact of maturity, and we just continue to build strength and movement qualities, and just kind of keep an eye on where he ends up in regards, or she. All these things could be a she too, where they end up in their athletic career. And so, Jules, I hope this kind of answers your question. I'm always more concerned about improving strength before improving size. And that's, to be honest, it's because you said baseball and softball, but realistically, I think that's always been the case. I'd rather have somebody who's more strong, and then the size will either come with age and maturity, or if they're already pretty slight and they're kind of in the 18, 19, 20, and they've kind of seen that growth, then we're going to start worrying about putting some size on them to make them more durable. But yeah, I'd want to make sure they're pretty strong when we're doing that, because that's only going to help. And then adding that size would be something that I would want to see happen over time. Yeah, you hear these stories, and I'm one of them. I went into a Division I baseball program as a freshman at 6'2", 151 pounds, and 8% body fat. I just didn't eat. I was a kid who just didn't eat. Just didn't have a ton of access to food. I mean, I did, but I just didn't eat it, and I didn't prioritize it. And I went into my freshman year in college, and they gave me a meal card and said, hey, you just go to the cafeteria, swipe this, and you get as much food as you want. So I came in, weighed at 6'2", 151 pounds, 8% body fat on end of August. And I went home for Christmas break on December 12th, weighing 185 pounds, 6'2", and 8% body fat. And so I packed on a lot of muscle, and which was great. My velocity, I was a pitcher, my velocity went up with it. So I averaged anywhere from 86 to 88 to 89 miles an hour at the time. And I'd hit, 90 a few times in high school. And in the fall that year, I hit 90 about 10 to 15 times. And I think the hardest I ever threw from a mound. And I had a 93 in there. And it was accompanied with the increase in size. But I also can tell you, I got way stronger than I'd ever been in my life. Now, that's this gaining mass thing over time is a great topic and something we can talk about another day for a long time. But I got an associated injury from all of that weight gain and loss of mobility, and also from a significant increase in velocity over a short period of time. I ended up sustaining an injury, not the elbow. My elbow was fine. It was something else. And so anyways, Jules, I kind of hope that answers your question. I kind of went off on about 5 or 6 different tangents, which happens quite a bit. And anyways, if you have more questions, or if that didn't clarify it, reach out to me and I'll try and answer it more directly. So, all right, let's move on to our second question. This one's from Raul. And Raul says, do you recommend that throwing athletes continue to throw throughout the year, even in the off season? What would your ideal throwing program be throughout the year? Raul, it really depends on the age of the athlete. Like I just answered Jules's question. Look, if you have a youth athlete, I want them playing other sports in the off season. So in the fall, they need to be playing football, hockey, whatever it is, something else besides baseball. And a large reason, because in the youth sports side of it, I actually kind of like the kids not throwing. I don't know if their bodies are ready for that amount of throwing. I don't want them throwing very much. And in all honesty, they can still throw, but I want those throws to be non-competitive. Like they're just out throwing. Heck, throw a football. You know what I mean? Change the way you throw a little bit. And I gave specific guidelines to a player 2 days ago. 12-year-old, yeah. And I said, look, your entire job for the next, we're in the fall, so dating the podcast here, but we're in the fall. And I told the athlete, I said, look, for the next 2 weeks, you're not allowed to throw with your right arm. He was having some arm issues. I wouldn't say pain, but you could tell that it was run down. I said, you're only allowed to throw left-handed. And then after that, you're only allowed to throw a football until Thanksgiving hits. And then once Thanksgiving hits, then you can pick up a baseball. And when you do that, here's your program. And I gave him a program, which did include throwing with his opposite hand still. So something to think about there, Raul. The youth athletes, I highly suggest they take time off of throwing. I don't think it's a bad thing. Now, as we creep into the high school age kids, as they start to mature, depending on throwing volumes, that's when I start deciding if they should be throwing in the off season or not. I still advocate opposite side throwing in the off season or light throwing with their dominant side, but in a non-competitive environment. They can play some fall ball. That's totally fine. They play fall ball. When they end fall ball, I tell them throw left-handed or their non-dominant side for a little while and light throws on the other side. But it's all really non-competitive throws, just trying to get the body loose. And then we always start our throwing programs. It seems to change a little bit from year to year, but as of right now, most of my guys start their throwing programs usually around the first or second week of November. At the latest, they're starting around Thanksgiving. And the idea is that gives us anywhere from 6 to 7 weeks to really kind of build volume and some endurance in the arm and custom the arm to throwing again. And as time goes on, those throws become more intense, and then they become more competitive as we get into January and February. And then obviously tryouts for us are in February, end of February, and that's when our pro guys start returning, and our college guys are already going by in February, so we've got them a little bit earlier, but our youth athletes are typically ramping up for tryouts at the end of February, and so that gives them a nice long time to do so. So, Raul, I hope this answers your question. Look, there's a study that came out not too long ago, and they looked at the UCL in the ligament on the inside of the elbow. And this is one of the things that they have been advocating for year-round throwing. And they looked at the elbow ligament, and they found that the elbow ligament, when you throw, the ligament gets thicker and longer. And when you don't throw, the ligament gets thinner and shorter. And everyone's like, whoa, man, that seems like evidence that we should keep throwing because we want a longer ligament that's thicker, right? And when people say that, I always think, do you feel like when you say it's thicker, like it's a stout ligament, it's got strength to it, and everything? And they said, yes. And I go, okay, so the more we throw, according to the study, the thicker and the longer these ligaments got. Yet, we're still seeing tears and we're still seeing issues. And so I said in my head, and this is something I had a conversation with a colleague of mine, is we said, look, we understand that those changes happen, and that sounds good, but I don't know if it's a good thing. And what we don't have a study on this, but what my speculation is that tissue, that ligament actually gets longer and gets thicker on an ultrasound because it has more fluid in it, meaning it's inflamed, it's irritable, and it's got a healing process going on it. And it gets longer because it's got more fluid in it, so it's not actually held together quite as well. So I don't think it's a good thing. Now, that doesn't mean we shouldn't throw. It just means that we need to moderate how much we throw to mitigate and making sure that all of those changes to the ligament happen at an appropriate pace, and we give the ligament a chance to be able to just relax and come back and heal with the time of down throwing. Now, I don't recall the study talking about if they had completely stopped throwing in the off season, if they controlled for that. These are minor league and Major League Baseball players that they looked at, and so I'd have to go back and look at that. But my answer to you, Raul, is anybody in the youth aspect, and I'd probably put youth anywhere from 14 and under, probably needs to have an off season where they don't throw and they should be playing another sport. I didn't say they had to stop doing baseball things. They can still hit. They can still do non-competitive throws, but realistically, I kind of wouldn't mind them to stop throwing and hitting, but they can continue if they'd like to. But I'd like to have them play another sport. And then, excuse me, and then 15 and up, non-competitive throws, make sure they're throwing with the opposite hand, and with a nice ramp-up period that always starts around the first or second week of November, at the latest in Thanksgiving, with a hope of returning to competitive throwing, pitching, and those type of things, end of February, early March. So, Raul, I hope that answers your question. Yeah, all right. That is our last question for episode 30. So I appreciate everybody tuning into the podcast. Please, if you have questions for the podcast, if you're listening on Apple, iTunes at this point, just go look down in our show notes. There's a link. Click that link. It'll take you to the webpage for our podcast. There'll be a button there. You can just click Ask Mike a Question, or you can go straight to the website, www.athletic-potential.com/podcast. And you can go ahead and click on that same button, ask your questions. We want to make sure we answer as many questions as we can. I feel like it helps a lot of people to hear the answers and maybe to identify some things that they can maybe do better, or maybe correct some things that may not be as good as they could be. So I appreciate everybody tuning in. I appreciate everybody taking the time. Please subscribe and rate the podcast. That helps us reach more people. And until next time, good luck and keep working hard. Thanks. Hey everybody, just want to say thank you for listening to the Athletic Potential Podcast. If you do have questions for the podcast, please visit the website www.athletic-potential.com/podcast. You'll find a button there to ask your question. Please input your information and your question, and we will answer any and all questions we get. We thank you again for listening. If you do get a chance, please rate and review the podcast. And until next time, thanks.